hydraulic conductivity or permeability. And of course the pathologies, I consult Robin. I do have other smaller books or other authors' books, but Robin is something which I use as a primary text. Same for physiology, I use Guyton as a primary text, and then of course I look at various USMLE questions and see what are being asked and what are various connections which are made. So hydraulic conductivity and permeability or permeability, same one term, and total surface area. What does that mean? Permeability means that if this is a glomerulus, this thing, how permeable is the membrane? How many channels does the membrane allow, and how good these channels are to allow the fluids to move out of it? It would be very simple to understand that more the channels and better functioning the channels, better the permeability. Bad channels, less channels, or damaged channels, less permeability. And that is why we talked about it. Remember, we said coefficient is not going to change on a daily basis. The reason for that is that it is not that today I had more channels in my glomerulus and tomorrow I have less channels in my glomerulus. If my glomerulus became damaged, how can it be damaged? For example, diabetes mellitus or hypertension can damage a glomerulus, and if it removed some channels, damaged them, now my permeability for this glomerulus has gone down. Or if the damage occurred due to infections, pyelonephritis, that caused at the end of the day scarring in this area, then the channels are damaged, right? So this is not going to happen. Today I have a damage to the channel, tomorrow the channel reappears. That will not happen. That is why this is sort of a constant. Total surface area is a similar ballpark. So let's say this is one glomerulus and this is another glomerulus. So let's say the surface area of one glomerulus is 1 millimeter square and the other one is also 1 millimeter square. So I have 2 millimeter square here. If due to some reason, for example, there is a kidney stone, or there is hypertension, or there is diabetes, or there is pyelonephritis, or there is chronic renal failure, for whatever reason, one of the glomerulus got damaged. So the total surface area, which was 2 millimeter square, is now 1 millimeter square. Correct? So now surface area has reduced. It is now normal, it is natural that if I could make, let's say, 1 milliliter urine, or I could have 120 millimeter of fluid moving out from these surfaces, and all of a sudden I reduce the surface area to half, then the filtration will become half as well. Similarly here, if there were let's say 4 channels, 1, 2, 3, 4. 4 channels caused 120 milliliter of the filtration. Then 2 channels got damaged. Filtration is going to go down to half, right? So you understand that filtration is going to be affected by the filtration coefficient. In a normal healthy person, filtration coefficient doesn't change that often. What things change them? So for the hydraulic conductivity or the permeability, so let's very quickly talk about it. See, this is how you're going to attempt this thinking. Now I'm going to talk about a couple of diseases. Disease is going to affect this. Remember we said 6 factors. 2 of the factors are in filtration coefficient. So whatever disease we're talking about is going to affect one or more of those 6 factors. So now let's talk about diabetes for a second. Diabetes mellitus. What happens in the diabetes mellitus? There is less insulin, or there is a reason for the glucose to stay out of the cells into the blood vascular system. So let's make a glomerulus here. So let's say this is the glomerulus. Patient is diabetic. What happens is there is more glucose running around, right? So let's say this is glucose. Happy, I'm having fun, I'm glucose. That extra level of glucose causes non-enzymatic glycosylation. Non-enzymatic glycosylation. One of the primary damages of diabetes is non-enzymatic glycosylation. What that means is glucose gets without the help of an enzyme, non-enzymatic, without the help of an enzyme, glucose binds to amino acids. So let's say these are endothelial cells. Of course, there are proteins. These proteins have gotten amino acids, right? Glucose, Mr. Glucose, forces itself onto these amino acids, right? So now glucose is stuck on these amino acids. This is called non-enzymatic glycosylation. Due to this glycosylation, number one, you are seeing already that the membrane will become thickened, right? Membrane will become thickened. That is one problem. The second problem is, under this glycosylated area, lipids will get trapped. Lipids will get trapped over here. Then more substances would get trapped. More glucose, more proteins, more substances, trash, debris will get trapped in here. That would, number one, cause, think about it, surface area and hydraulic permeability. One, it would damage the permeability, and number two, once the scarring occurs here, the surface area is going to go down, right? So that is what happens with the glycosylation. Glycosylation, on that topic, remember one more thing. There is a thing called AGE, Advanced Glycosylation End Products. What these are is that if there is a continuity in the glucose level to be increased, so the patient is diabetic and is not controlling his diabetes, so that means glucose level stays high for a long time, then various areas which become glycosylated, various chemical substances which become glycosylated will be called AGE, Advanced Glycosylation End Products. In that, not only the endothelial walls and the substances here, but also the proteins which are running around in the blood will also become glycosylated. For example, give me an example of a protein. I'm sure that you've heard of it. Hemoglobin 1, A1C, yes, right? Why do we use that? To understand the long-term effect of the control of diabetes. Why? Because it is a protein, hemoglobin, and that protein is become glycosylated over weeks and months. So glucose keeps attaching itself, so that would be called an AGE, Advanced Glycosylation End Product. So many proteins, many substances, many amino acids get the glucose attached to them. We are concerned right now, you know what happens then? These AGE products, they get trapped in the AGE receptors and they cause sclerosis, they cause thickening, they cause damages, and that is the effect of diabetes, one of the effect of. The other effect, I hope you understand, is the other effect of the diabetes is around the osmotic changes. So back here, glycosylation diabetes mellitus would cause the glomerular membrane. So if I show you here, this membrane will become damaged. What kind of a damage are we talking about? Thickness increases, scarring would occur, debris would become stuck there, and the permeability would reduce. So hypertensive patients over years, you will say, hypertensive, did I say? Diabetic patients over years, you'll say, will have an effect on the hydraulic conductivity. So if a patient comes to you who has diabetes for 10 years, 5 years, in that patient it is fair to think about his coefficient. And this would, reduced coefficient will mean, so remember GFR equals net filtration pressure multiplied by filtration coefficient. So let's say if the net filtration pressure is 160, I'm just making up a number. Normally the net filtration pressure is about 8 millimeter per, let's just use 10 millimeter of mercury, and coefficient GFR normally is 120 milliliter per minute, so that means about 12 will be the coefficient. We'll talk about how to calculate the coefficient in a minute. This is for the whole kidney, and whole kidney is about 300 grams, so 12 is about 300 grams. So 10 millimeter of mercury and the coefficient is 12, so that makes 120, right? Now if due to diabetes mellitus the coefficient goes down to 6, then that would mean if the net filtration pressure stays the same, then the GFR has reduced to 60 milliliter per minute. Make sense? Do you understand? But this is a long-term thing. You cannot say today I got diabetes, tomorrow I come in and I have a coefficient change. No, that's not going to happen. Okay, next thing, hypertension. Hypertension is another thing which can cause permeability changes. How? This is how it does it. So let's say this is the membrane. The increased blood pressure